I'd like to talk to you a little bit about back pain. My wife, Virginia, and I have worked with a number of people that have had lower back pain, mid-thoracic pain, cervical pain. Migraines very often are a form of spinal compression. My wife and I have both had a lot of experience, in fact, working at the Texas Back Institute in Plano, Texas for a year. Saw a number of patients that were referred in by physicians, pain management doctors, orthopedic surgeons, as a way of seeing if there's some alternative treatment that we can do to keep these people from having to undergo surgery. We've also worked with people that have undergone the surgery and they're still in pain and they want help, they want results, they're tired of living on the painkillers. Do they do another surgery? Do they take more painkillers? They're frustrated, they're at the end of their rope. They're looking for answers. Unfortunately, there are a lot of people out there that are looking for desperate people. I will make no bones about it that I feel very confident that I can help most people in this type of pain. And I say that just from experience. I cannot help everyone, but I would like a chance to talk with people individually to get a feel for their history and what kind of tests they've undergone and where the pain might be stemming from. The approach that I do and how it differs from some of the other modalities and other treatments that are out there is that what we're doing is working with the connective tissue. You may have heard me talk about fascia and connective tissue, and it's a very important topic, and you'll hear me talk about it more. The idea is that the spinal column and all of the vertebrae that are stacked up on top of each other are held in place by this fascia form of connective tissue. What happens frequently is that this fascia gets constricted and it tightens and it pulls down and it compresses the vertebrae tight on top of each other, which can cause a bulging disc, and that can accelerate into actual damage into the disc and a ruptured disc. At the point that a disc is ruptured and leaking, it's very likely that surgery is indicated. And surgical mending can be a wonderful thing. And if somebody needs surgery, absolutely, they need surgery. If the disc is bulging and has not yet begun to leak, and it has not yet ruptured, and it's simply a pinched disc, a bulging disc, a herniated disc, probably structural integration can help you. Going back to the idea that this disc is being compressed by the vertebrae that are squeezing together on top of this disc, and that is held by the connective tissue. Structural integration intervenes directly into that connective tissue, and what we do is we lengthen that and free it up. Now, this is different than massage therapy. Massage therapy works with the muscles. And there are those that will say, well, I'm a massage therapist and I work with fascia too. And it's true. There are a lot of really good massage therapists that do myofascial release. And that is a combination of working with the myo, the muscular system, and the fascia system. Structural integration differs, however, from simple myofascial release because what we're after is not simply release. Structural integration is just that. It lives up to its name. It is integration. So we're not just going to a tight spot to get it to let go. We're looking to, yes, get the tight spot to let go, but only towards the greater goal of getting the body to work together in an integrated way, so that these two vertebrae that are squeezing on top of each other have a better relationship to these two vertebrae and to these two vertebrae and these vertebrae out into the extremities and so on. So there is a way of working with the connective tissue so that we're spreading the release that we get through the entire system, spreading the goodness all around so that this pain, which seems to be spreading all around, we can reverse that process. How it differs from some of these other modalities is massage therapy will work for release of the muscular system and can work in some of the fascial system. If the work is simply release work, it's not going to be very lasting. You'll feel better. You might feel better for a day or a week or a month, but if we're not changing the whole structure, it's going to be a short-lived success. Dr. Rolf taught us that in order for any part of the body to stay changed, you really have to change the way every other part of the body relates to it. That's really the meat of structural integration. A lot of people pursue chiropractic. I love chiropractic. I see a chiropractor myself. I think some people go to chiropractors that are in need of something other than what the chiropractic is offering them. And let me explain it this way. If you have a vertebra that is misaligned, subluxated is the term that a lot of chiropractors will use. Typically, unless there is an actual skeletal deformity, unless there is some problem with the bone itself and it's misshapen since birth, what you've got is really a strain pattern in the body that's pulling that vertebra out of place. Say you've got a simple model of you've got your spine here. On either side, you've got the muscles that go up and down the back like these two big ropey muscles, right? Well, one rope has gotten bigger and tougher and a big knot in it than the other one does, and so it pulls that vertebra over to the side. People come and say, it's this knot that I got right here in my shoulder blade. It's very common, and what happens is it begins to pull the spine out of its alignment. And if you're getting skeletal work and chiropractic adjustments without the consideration that probably what you have is a solution that needs to be twofold. Yes, you need the chiropractor to put the bone back in place, but there needs to be a lot of consideration done to what we can do to reorganize the connective tissue so that it will support the change that the chiropractor can bring about. That is to say that if the vertebra goes out of place because the muscle is pulling it and the chiropractor simply shoves it back in, adjusts the vertebra back into alignment, the knot's going to pull it back out again. The chiropractor pushes it back in, the knot pulls it out, in, out, in, out. You're creating an environment of hypermobility and perhaps worsening the situation, the scenario of dysfunction in your spinal column. In structural integration, then, what we're doing is changing so that we're creating balance and symmetry in the way the muscles and the connective tissue, more importantly, are supporting the skeletal system, so that then as the chiropractor makes the adjustment, then there's not a knot that's pulling it back out.